If you're one of the millions of people who experience lower back pain, this video is for you. We're going to discuss some of the most common exercises that can increase low back pain and how to either modify those or avoid them. I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. If you've ever suffered from low back pain, and I have multiple times, so I know it too, but you know how hard it can be to exercise. But to be fair, not all exercises in the weight room are equal. Some put more stress or strain on your lumbar spine than others. Knowing how to avoid this extra stress can allow you to continue exercising while avoiding making the problems worse. So some of the exercises that potentially would be problematic are worth talking about. The first would be stomach crunches and sit-ups. Now, these exercises place a lot of pressure on your lower back, so they can cause back pain. Maybe instead of doing those exercises, there are other exercises you can do to strengthen your core that don't actually hurt your lower back, that actually, if you do them long enough, may actually prevent you from developing back pain in the future. Back extensions are another one that might be important to avoid if you have low back pain, because they again put stress on your lower back. Back extensions they basically involve, if you're lying face down on a bench, maybe your feet are anchored behind you, or you're on a mat with the legs behind you, and then you lift your upper body off the floor using only your lower back muscles, the erector spinae muscles. This puts a lot of stress on your lower back, and if it's not done correctly, not done with supervision by a physical therapist or an athletic trainer or a personal trainer who knows how to modify this movement, if you have certain lower back issues like a herniated disc or spinal stenosis or degenerative disc disease, it can very often get worse. Deadlifts. Deadlifts are a great exercise for a number of different reasons, but they can be problematic for somebody with low back pain. They work your hamstrings and glutes, and they can affect the muscles of your lower back. If you lift weights during deadlifts, there is a risk, though, that some of those muscles will tighten up or become strained in your lower back. Even with perfect form, usually deadlifts aren't a big problem, but once you start having low back pain, even when you do deadlifts perfect form, it can cause low back discomfort. So that's another reason it's important to listen to your body when doing any type of exercise, not just deadlifts. And if it doesn't feel right, stop that exercise immediately. Last, barbell squats. These are great for your quads, great for your glutes, but the axial load of that weight on the barbell on your spine might not be good if you're having low back pain. There are a number of different exercises to work your quads, work your glutes and lower extremity muscles that don't put that kind of stress on your lower back. Now, not all exercises, as I said, are good for people with back pain. Don't do anything that hurts your back or causes you to have more pain than you did before you started the exercise. If that happens, stop the exercise, find another exercise that won't cause that low back pain or really pain to any other areas in your body. Those exercises that I mentioned are not inherently bad. In fact, for most people, they're very good for you. All of those exercises can be done safely if you know how to avoid putting the extra stress on your lower back. That's where I really like having people work with a physical therapist. They can watch you do the exercises, show you how to modify those exercises so that you don't cause pain. Or they can show you other exercises that work the same muscle groups without making your low back pain worse. In conclusion, it's important to know which exercises are safe for your back, which ones aren't. If you have low back pain and you want to start exercising again, it's really important to consult with a physical therapist or doctor. I'd love to hear about your low back pain and your lower back injury. Leave those in the comments below. I do read those, but just know I don't usually respond because it's not legal to offer medical advice online. But I do use those questions to come up with ideas for new Ask Dr. Geier videos. So make sure to subscribe to my channel. Click the bell to be notified when I release a new video or when I start a live stream, like my Ask Dr. Geier live shows. Thank you so much for watching. Look forward to helping you feel, look, and perform better than ever.